Uh, you'll pardon me. It's the first time I'm speaking in a platform like this. Uh, I've gone to the loo, I don't know, 7 times, whatever. But luckily for me, am I audible? Good. Luckily for me, the speakers that were before me have taken so much time. I have little time. People are thirsty. People are tired. So I'll just get onto it. But we can sit down now, and then I know we are awake. Okay, I'll acknowledge the DPA in the beginning. I know it's usually at the end for even thinking about mentioning me as a speaker, especially the last speaker. I don't know, but I think the last speaker is very important. I think, I assume. But my journey has not been an easy one. If you read the Bible, I would call myself Saul and Paul in one person. So if you're still stuck on the Jobela you knew at tertiary, you lost. Dr. Ndwandwe doesn't know that person. I'm a changed person. Uh, so don't tell her anything, you know? Okay. Yeah. The background. I'll just get on to it because the time is not on our side. At that hospital, the one thing I realized when I got there was that my supervisor, for instance, at 12, he would decide to, you know what, just close the clinic. We were free to do whatever we wanted to do, go home, drive to the nearby towns. I took it upon myself to say, you know what, there are patients that we get after lunch. What if I practiced all the skill that I can acquire to do procedures that at school I was struggling with? For instance, impactions. I started doing them after lunch. And I tell you now, if you can show me an impaction that will be difficult for me, I don't know what kind of impaction it will be. So my point is, it doesn't matter how rural the place is, you can gain something from you dedicating yourself, helping the patient. The hospital, Matateni Hospital, which is 100 k's away, had a specialist that was there who was moving back to, is it still called Barakwana Krisani now? He was moving back to Krisani, so I was stuck with those procedures. So I took it upon myself to say, you know what, I can do this, you know. But I drafted consent forms even then, even in public health. I thought, you know what, a lot can go wrong. Let me just make sure that I'm covered. So I sorted. So the experience, as rural as the place was, I've gained a lot from it, be it dentures arranging with nearby dental therapists. Luckily for me in KZN, there's a lot of dental therapists. There's not that much of dentists, you know. So dentures, every patient that I would see at the hospital, I would refer. But then when the patient gets there, because of ROPS, by the way, the patient would find me again. I'm there, I'm doing the denture, and it would work very well. I'd like to correct you, Dr. Kongo, on one thing. Newcastle is not rural, Ngutu is. I got to Newcastle, it was a different ball game. Newcastle, out of 10 patients that you meet, I'm basically in Osizweni there. Out of 10 patients that you see, you find that 7 of them are saying, you know what, I want gold, you know what, my uncle's medical aid, blah, blah, all those stories. I looked at this and I was like, you know what, I'm busy chasing these people away. Then I came up with a formula because I wanted to do things legally and ethically. I would be like, you know what, instead of chasing the person away, can you bring the owner of this medical aid? That's how I started. Then treatment plans were drawn. I would do the treatment on the other on the patient who approached for free. I wasn't charging it. So that's the strategy that I used when I got there. I got to Mlazi, different ball game. I get there, Mlazi, first week, I'm working in Mega City, not far from Max and Ayadini. A lot of people know that place. Those people are different as well. I get there, I'm applying the same approach that I used to use in Motu. I give patients the trust that if I cement your bridge and you go home, you're still going to come back and give me my money. The first patient I did that on disappeared, you know? Then I was like, you know what? Places are really different. Palito, different ball game again. I went to Palito, it's been 2 years now, but the practice is only a few months old. When I got there, I was studying the socio-economic status versus the demography and how people can afford the treatments. It was a different ball game. People there, they come to you, they tell you, you know what, how much do you charge for an implant? I know what an implant, will you need to do bone augmentation? A patient is asking you that. So if you blank, then you're in trouble. At Tegwini Heart Hospital, different ball game again. I get there, I try to remember the notes that are from school where we always used to be told by medical professionals that patients who are suffering from heart conditions, they always need to have the best dental treatment prior to their surgeries. I use that strategy. So the whole hospital, I have a practice downstairs that I work with Dr. Maharaj. It's a normal requirement that you go by us first and then you go and be admitted. So it was different strategies for all these different places. Next slide. The topic is Corolla versus Lexus. Just pardon me, I'll be very quick because of time. Corolla versus Lexus. This saying was coined by our most respected Dr. Nkumeling. But I want us to just branch from the approach that he uses. I'm thankful he's not here, so he won't do anything to me. Yeah, no, I'm fine. I'm fine with that. I'm good. It's not about, you know, when you hear a topic like mine, you're thinking, oh, he's going to come and show us his gadgets and the fancy palito. No, no, no. It's the approach. That's why I was giving you that background. What's important is the way you approach patients. That's why the approach is written like that. Is what makes you the Lexus. It's not your CPC team. It's not your pen. If you can afford it, good for you. But it's your mental strength that will make you be the Lexus that you want to be. There's nothing wrong with the Corolla practice. It just depends on where you are. You know, I'm looking at Dr. Buleni presenting. I'm thinking, her practice is called Smiles Dental. But this person doesn't smile when it comes to money, you know? You know, she wants her money. You know what I'm saying? Can you give me the next slide? There is a Corolla we all grew up with. It's either a neighbor or at home you have this car. It's the most reliable car there is. Remember, this is South Africa. Let's be realistic. Our communities, we know how they are. You know, you can come here and claim to be that dentist that's Uber, all you like, but our communities, even at your own home, you are a dentist, you're talking to your siblings. At home, there's 2 dentists, but still the questions that you get, you know? So we need to come down a bit in order to be up, because the majority of the community, they need this. This is what they know. You can lie to yourself if you're in a smaller town. We can call it intermediate, like Newcastle. No one will walk to your practice requesting an implant. No one will walk into your practice requesting a root canal treatment. You know, it's not usual. I have another practice that I work with Dr. Raman in town. It's a different thing. I refer all my patients there. I go there. Whenever there's a procedure, I'm there as well, because they are not at this level. There's nothing wrong. That's what I want us to understand. There's nothing wrong with the Corolla. It's just how you deal with it, but I'll get to that a bit later. Next slide. Yeah, a few of us are there. A few of us, I just, you know, they are there, but what I like about them, the fact that they are in the DPA, they keep on saying, please, you don't have to do like us. Even though I was very confused the other day, I talked about SS White in the group, and everyone was like, what? I asked, and people said, no, we're scanning nowadays. I was like, Is everyone having a scanner? You know, I was a bit shocked, but fine. But that's where we wanna be, that's where we wanna aspire to. I'll show you later. My view is this: the priors, those who follow Hollywood movies, whatever, they know that a lot of stars, the famous people, are going for this car because of the carbon emissions and whatnot and whatnot. You don't have to be the top of the range. You don't have to be the bottom of the range. Be efficient. That's what's important. Wherever you are, understand the socio-economic status of the place, understand the people, sit down with people and understand how much they know, impart your knowledge without really making them feel small. If a person walks to your practice and they say, you know what, Kinyaga L, you know, I don't know about others. Some people, the patient doesn't even get to the dentist. I mean, I get paid for consultation. So I sit you down in the office. You will explain your thing. I don't undermine it. I listen to you. And then I explain to you what's the importance of preserving tooth structure. Why is it important that I differ with you? You know, we get to an understanding, if I may call it that. So just be average, but in your mind, you know you want to be the Lexus practice. Okay, these are the topics. I'll just go through them as we discuss them deeply. You can give me the next slide, please. Location. I got to Durban and realized something. I always visit my friend Udirile. I know about the cat cams and I go around, believe you me. I live next to the airport, by the way. It's like a taxi rank to me. So if I just go there, before, before before you clap, there is fly surf air. So flying is no longer there. It's 350, 450, 550, depending on when you book. Actually, driving doesn't make sense anymore, you know? There's no need to clap. It's no longer stop posting pictures of you at the airport. It's cheap, you know? It's cheap. I realized that, you know, there's labs that you can have only a scanner. You send the jobs to them. I'm talking Palito now. These people know and expect a crown that will be fitted on the same day. In Newcastle, you tell them 3 weeks. You take the whole 5,000, I don't know. If I'm undercharging, I'm sorry. You take the whole 5K, you use it wherever you want. You can tell the patient 3 weeks, I'm sending this to Durban. It's a big job. The patient understands. In Palito, no. During that break, when the patient comes to you, they expect you to cut the crown and fit the crown and they go back to work and they don't play. If they have to fetch a child at 1:15, they have to fetch a child at 1:15, not 20 past. So it's a different ball game. So now I've realized there's labs that offer the services of you cutting the crown, taking the impression, they provide transport to come. You can do it digitally even. You know, let me not talk about the ones that come fetch the impression. If you do it digitally with a scanner, they will make sure that they bring the crown back maybe in 2 hours. You negotiate with the patient, listen, come back in 2 hours. Let's say when you knock off, I'll be here, I'll fit your crown. It depends on where you are. Labs are different. That's another thing I want to talk to everyone. We go back to the issue of being Lexus. I went to Durban. I won't mention the lab's name. It's a very popular lab. Everyone is using it. But I realized one thing. I was struggling with fitting partial dentures, something I don't know. You know, you fit a partial denture, it's just off. There's a space, there's whatever. So I knew that when I was in him, you know, until we sat down with the traditional council of the area and I tried to present my case because I didn't just think of myself as a dentist. I thought, let me sit with these people. Let's see if we can come to a conclusion. Let them understand, because remember, we're not allowed to just discredit any religion, any culture, or anything like that. Ne? Okay, let's talk institutions. Before I'll go back to specialists later, you'll see why. Let's talk institutions. If you're in Pretoria, Joburg, I don't really understand how you can have a practice where you say, this type of procedure I don't do. Because remember, there's DPA. You see a case, you just post. How many advisors do you have? Like, really? How many advisors do you have for you to say, you know what, this I cannot do at all? And you refer the patient. You just send the end of patient, everyone. Udirile, Dr. Udirile, Dr. Udirile. Can't you just learn, or even worse? This is what I do. I'm a very invasive dentist. She will tell you. That's why she's nodding. I come to your practice anytime. I want to learn. If you have a patient, I come there. I look at what you're doing. If you're good at something, I want to learn. If I have a patient that I need to refer to you, I come to your practice. We treat the patient together, because next time I have to learn how you did it, because I'm going to face the same situation. So that's the beauty of working in different environments. And then shopping malls are a given. The location in shopping malls is very important. Your marketing, it affects that a lot. Taxi ranks, you might want to have a Lexus practice. Unfortunately, it depends on the taxi rank as well. You can work next to a taxi rank, but you want to have a Lexus practice, but the saloon next door is playing John Vulligate, you know? So the type of clientele you'll get there, unfortunately, the location will not agree with you. That's the unfortunate situation, and you need to accept it. Next slide, please. Okay, let's talk technology. That's what everyone thought I was going to talk about. Equipment-wise, I've covered some part of it, you know. Equipment, this is what I was told by a good friend of mine, Dr. Mpungos, and not the prosthodontist, the periodontist. We're very close. He came to look at a site that we're looking into with her. She won't like that, but I'll look this site. In Mhlanga, ne? She was like, Dr. Jobela, listen, I invited him so he could look and decide. You know, this with CPCT, there's planning that has to happen. I was hoping, it's a dream, you know. He was like, no, you don't need a CPCT here. Just have a chair because of 1, 2, 3. My point is, we're thankful and hopeful that we all will afford all these gadgets and equipment one day. But do not shy away from diagnosing implant patients because you're thinking, no implants, not for me. There's a first stage that you can do where you would have the patient diagnosed, exam done, because you need to separate segments of the treatment. Don't just say, you know what, this I cannot do. So have the equipment that you can afford. The equipment will facilitate. I can mention the equipment. I can show you pictures of equipment. Time won't allow us. You know what I'm talking about. Your water lace, your CPCT, your fancy 3D pens. Have what you can have depending in the area and the demand of your patients. Stop looking at the DPA WhatsApp group and just keeping quiet because you're thinking, oh yeah, they are the good ones. They are the ones who have everything. No one has everything. Be the Lexus in your own corner. Make sure there's no patient who can be here and angatoli is savers in a way of you talking to them, consulting with them, or even referring to a nearby person who has the equipment that's necessary. Gadgets, like really, why are we struggling with having, a tablet? You can use a tablet for the kids that come to the practice to play games. It can enhance your practice. You going Lexus Road by doing that. In Palito, those kids, they are something else. They are something else, believe you me. They look at you up and down, they look at you, they're running around. Have a tablet. You don't have to have an iPad. Have a tablet with games. It will change your practice. My presentation is focusing on you being the Lexus, not only on the practice, but you thinking that, you know. Uh, can we go to Wi-Fi? Wi-Fi is just an obvious one. Can we just make sure that you have Wi-Fi? Because everything technology relies on it. This is all. This is not Palito, by the way, it's Boxback. I come here often. It's Medicare. It's, can you go back a slide? Just look at that sanitizing booth there. When I walk in, I go through a passage and then the sanitizer everywhere. That's what happens. It's here in Boxback. I come here once a month, I think. That's the room inside. There's your pen, there's everything. The type of clients, the approach that they use here is different. I'm talking technology-wise. I'm learning from them. You would expect when you see a topic like that, you think, oh, Dr. Jobela is there. No, 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 I'm learning. The only difference is that I always go and learn. Next slide, please. There is the tablet there. I want you to look on the right of this slide. That's the temperature monitor screen. This is not expensive. You would look at it and you think this is fancy. It's not fancy. This is just your normal 32-inch or your 40-inch screen, that monitor. But a patient, immediately when they look at that, they're thinking, wow, this I have not seen. It means the treatment that I'm getting inside is also on that level. So it convinces them somehow. Next slide, please. Very important one, staff. I cannot emphasize this enough. You can have your CAT cam inside, you can have your whatever, your lace. But if your assistant is sitting like this, when I talk to them, I tell you, there's nothing that you can do. You have to talk to them. The appearance says a lot. It's very important that when you look at the assistant, then you think that you're going to get the proper treatment. Unfortunately, with dentistry, they need to have a bit of information because the person who's asking questions, they are the first contact point. The patient will not even get to you. As brilliant as you are, it doesn't matter. If your stuff is not Lexus, you will not be Lexus. You can do whatever you like. If I come there and say, how imalengaga for then the patient, you're not getting that endo. Convince the person why they need the endo. Convince the person, you know what, look at it. You've lost so many teeth. Discuss the treatment plan with them. But the first point of reference is the assistant. Teamwork, same thing, education. Take them to courses. Take them to courses. I was telling my team in Palito that, you know what, if in the way you walk, I want to have a modeling contest inside the surgery. The way you walk inside the surgery, when someone walks like this, the patient, you think you Lexus, but the walk is not Lexus. Next slide, please. I won't talk much about the branding. I think it's obvious. Can you please have a clean, precise branding? Can the people have your name over and over again? I'm just talking about, I'm more focusing on the angle of you not really needing money to invest in your business, but you doing the basic, simple things just to make sure that you're different than the next dentist next door. That's all, There is no reason why you don't have a mug that has your logo. Why not? That you give to maybe certain patients. I know mugs are expensive. They go 75 rands per patient or something. But imagine if every time a patient consulted, you gave them something with your logo. It could be a disc holder, it could be a key holder, it could be, you assess, you know your pocket, you know exactly what you need to look at. Have a proper logo. Discuss it with other people. That's the first thing you can do. Have a logo, whether it's a pen, you decide, you know your pocket. We cannot force you. You can be in the group with, someone might afford, I saw somewhere here a laptop bag with a logo. I was like, wow, that's a new one. I've never thought of that. I will think something about it. Have a proper branding logo. Can you? Oh, that picture didn't come out nice, but that's not idols. That's me in the consulting room. It's in preparation for the launch. It's next week, actually. Believe you me, this guy's mother is the CEO of Nkosi Albert. I didn't care. I wanted to hear him play the guitar that he wants to offer for the launch because I'm not taking prisoners. I want to make sure that the launch is on Saturday next week, 21st. I'm there like Randall on Idols, you know, I'm listening to every song. I'm thinking, no, it's a yes for me. That's what I gave him, you know. That's my partners next to me. Next slide, please. Promotions. I don't know. I won't call them promotions, but just your practice will be Lexus because you know what's around you. It's Diabetes Month in November. Know that. Do something. Oh, that's my sister, by the way. Some of you know her. She was here all the way from the UK just to help me do that. You know, there we were at an athletic runners club, blah, 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 so to speak. We are telling them about diabetes and the relation of diabetes with dentistry. 70% of them are white, they are health conscious, but we've introduced them ourselves. The business cards that we gave them, already they're phoning, they want to give appointments. Can you be out there? Can you know the health calendar? You can't be Lexus if you don't know the health calendar. Know what's happening in a particular month. Go participate. It's free. You don't need to spend anything. Next slide, please. Same thing there. Sorry about the slide again, but that's a breast cancer awareness. We were running along the beach in Durban. It didn't cost us a cent. It's just we paid for the T-shirts. The team is right there at the back. But I tell you, after that day, I realized that the actual cause for this, there was a breast cancer survivor who happens to be a COO of something that I won't mention, but that's going to be very beneficial to the practice. So again, same thing. How does this link to the practice? Be exposed. Be out there. Don't just close yourself in the corner and hope people will come. And you're like, oh, it's a quiet day. What quiet day? Have you gone to a church nearby? Have you gone to a school? Have you told them about yourself? Have you made them aware? Have you supported their initiatives? That's very important as well. Next slide, please. Hey, that's a big one, eh? Collaborations. You know, I'll speak for KZN. We don't have a tertiary institution that has BCHD or BDS there. So every corner there's a dental therapist. Stop being high and mighty. Imagine if you offer your services to all these people. They're scared of impactions. They don't do endo, they don't do ortho, they don't do, I don't know, it's a long list. Just go there, go to them, talk to them. Link, make your practice, invite them to your practice to come and work on their own patients. Stop stealing patients. Stop telling the patient, I'm better than her. By the way, my qualification is how many years more? If you link with these people, you will learn a lot because they've been there for years. You can count. They can tell me, I have few colleagues here who are from KZN. We can count each other. We know each other, actually, most of us, because there's no dentist there. There's just a few of them there. It was guys from Texas. We're doing an outreach project in Dandi somewhere. Below, it's Tandega. We work with her in Mlazi. She's a fantastic dental therapist. She books specialized, like in no way. She diagnoses specialized cases. She doesn't touch anything. I go there once a week, but it's worth it. Trust me on that. I go there once a week. The patient fully knows everything, has been referred for a pen. Can you teach the dental therapist next to you? Can you teach the dentist next to you who's scared of endo to at least try and open the access cavity, remove the contents of the pulp? Well, if you look at it and you're thinking, oh, I'm losing time and time is money. But remember, you teaching this person, you will do the difficult cases. I do that with impactions. I let them try, and then you bring it to me if it's a problem for you. Then I handle it. We can proceed. Demographics, yeah, it's just to say this is about culture, you know. KwaZulu, you know, all of us, we know that with culture, they are very distinct on culture, you know. Bayakubuza bathi wemfana wami izinyo liyakhishwa mahlupha uyabona, and izinyo kufanele ngiyolibika emsamo. If you try and explain endo in Nquthu, yo, it's difficult. It's really difficult, you know. So you must understand the thinking and get off the high horse. Just explain. Bayakutshela bathi lalela wemfana, uthi manje leli zinyo usho ngeke liphinde nhlobo lingihluphe. Laphinda ngenze njani? You understand? Uh, I tell you, it happens. I did it to chief in the area. We're still struggling with payment, but because he's a chief and the board of the hospital in the hospital, I had no choice. I had to do the endo in the public sector. Started there. Obviously, we couldn't finish it there. But I tell you, I'm struggling with him as well, because whenever there's reinfection and I want to refer him to the specialist that's nearby. I don't try and be a hero, by the way. I don't solve all the cases. I work with a lot of specialists. We are friends. If I tell them to drop the prices, they drop the prices. Your specialist near to you will do that if you liaise with them. It depends on how many patients you bring to them. They don't have a problem. They will tell you, come, try it first in front of me. Let's see how it works. Basically, the most important thing is what I call the neighborliness, and just being down to earth and not look at yourself as an isolated person. So that I was showing you ukuthi isiZulu, and the fact that you guys have assistants that are like, someone says it's either wenza endo noma wenza. Imagine the patient has never heard of the word endo. You know, let them explain to the patient. It's not like the patient comes to you and they tell you, listen, this tooth is painful. I did endo here. I did a crown here. I have an implant. You know, they know. Then you think, oh, okay, I have a window there. I look at the car they're driving. Oh, I don't have a price list, by the way. I look at you and okay. Ethically, it might not be right, by the way, but let's pass. Next slide, please. So, in conclusion, it's the fact that if you believe it will work out, you will see opportunities. If you believe it won't, you will see obstacles. The point I'm putting across is this. I've known Dr. Matlakala all my life. I've known Dr. Udirile almost all my life. I was watching them carefully, and I thought, I once posted a post, I think it was, I had just removed an impaction, a very complex one. Dr. Mulukume commented, you know what he said? He said, we are not fascinated by people who just extract. We want to save teeth. I was like, no, that's a challenge. Then I started my endo. My point is this, learn from these guys. They don't need to help us, but all they say every day, all of them, we have struggles. We break files. We sometimes don't find canals. So who are you to say, no, I don't do endo, I just hate it. Start small. Just open. That's what I used to do in Newcastle for Dr. Raman. He's doing strictly endo. He sees 8 patients every day guaranteed. It's the endo, it's the crown. endo crown only. He doesn't do an extraction. I saw my opportunity. I was like, oh, okay, I'll extract for him. I used to extract 70 patients a day in Mocho. Extraction is nothing for me. So I decided I go to his practice, I extract, but I won't just let endo go. I will open these excess cavities, I will remove the pulp contents, give him the patient. I didn't care about money. Then he felt like, you know what, Dr. Jobela, let's do the endo together, you will claim. Then we started. That's why I was not posting, by the way. Because I felt guilty. It was not my entire work, Then I started working. Now I'm doing my cases. I promise I will post. There's an issue, Rapatem issue that we will sort later. But I do a lot of endo. So my point is, it's all in the mind. Dr. Nkumeleng, I hope is not angry with me, but I'm saying get the gadgets if you can. If you can't, it's fine. Don't feel bad. The person next to you, they're not all nice. You will find that one or two that's nice. I have a MaxVac next to me. I have a periodontist next to me. I have an orthodontist next. So there's nothing that I can say this I cannot do entirely. I don't care who you are. You want an implant. You've been over. I have patients flying from wherever, from Cape Town. They come, and I'll be like, no, I can do it. I know for a fact that, you know what, I'm very close to the airport. The patient is coming from Cape Town, and then I have the dentist coming from Joburg. I fetch them at the same time, same Uber. They come to my practice, But the procedure is done. I pay the dentist whatever the dentist needs to be paid. But what's important, the procedure is done. The patient is happy. That's what's important, Can you move to the next slide? Yeah, it's a thank you. Probably on this, I would like to just acknowledge and thank the DPA. And in conclusion, it will sound like a repetition, but I'm saying, can we please comment on the platforms that we are provided? You have about, I cannot even count how many dentists are listening to your story. Post, let it not be the same people who always ask questions. Post, ask your questions. You are teaching us by doing that. We are learning from your case. Don't be in your own corner. Form a group in your own town. I once invited Dr. Matlakala. He saw in Newcastle. I asked about his secrets. I took him to some very popular Shisanyama. They're trying to confuse him. It worked. That 2 hours that we sat there worked for me, because then I woke up. I realized he told me about his ortho journey. He told me about his lies about Dr. Nkumeleng and other people. So my point in conclusion is this. Please, can you not be an individual? You are in a town, you are good at something, someone else is good at something. You are going to learn from them as much as they can learn from you. If someone looks at you, like I said in my introduction, as Saul instead of Paul, it's their problem. You have taken a decision from now onwards that, you know what, you will approach the dentist next to you and realize the dentist will tell you, I hate bridges. You will say to the dentist, hey, I have a struggle with endo. If you two work together, have one day in a week where you're thinking, I'm traveling. I'm going to another person's business place, the surgery, and I'm going to watch and learn. Slowly, slowly, you will develop yourself. So in conclusion, Lexus is not the practice. Lexus is you. Thank you very much.